Hello again, Dr. Scott Perocta from Healthy Life Dentistry. We've talked a number of times now about inflammation and its role in oral health, or more importantly, oral disease, and certainly its role in systemic disease, namely heart attacks and strokes. We also talked about longevity and what I coined as shortgevity. What we didn't talk about is what can the dentist do to impact your tendency to live a long, happy, healthy life or a short one. 50% of Americans die as a result of cardiovascular disease, a heart attack or a stroke, and that number is only rising. 1/2 of all Americans die as a result of cardiovascular disease. What can your dentist do to help? First off, over 85% of the clots that are found to have caused a heart attack or a stroke contain dental bacteria. No question, dental bacteria is a nasty, potent, inflammatory, invasive bacteria. And it doesn't just stay in your mouth, it travels throughout the bloodstream. So, what can the dentist do to impact your longevity? There are numerous sources where dental bacteria can affect your overall health. The biggest source of bacterial burden in the mouth comes from periodontal disease. Over half of all adults have some sort of periodontal disease. More Americans lose teeth as a result of periodontal disease than they do as a result of dental decay. So the most important thing that dentists can do for their patients is to continuously evaluate their gums. Healthy gums don't bleed. If there's any sort of bleeding in your mouth, it is a sign of infection. It is up to the dentist and the patient to figure out why it's there and what has to happen to make it go away so that you have healthy gums and therefore you don't have that bacterial burden in your system. Another sometimes significant source of infection has to do with the nerve of the tooth. Large fillings, large cavities close to the nerve area can cause infections in the tooth. Sometimes those infections don't hurt and people are not aware of it. Other times there's dental pain. Some of these teeth are in need of a root canal to make the infection go away. Some of them are teeth that have had root canals that have unresolved infection. I am more vigilant than I have ever been in reading x-rays and finding out if there is unresolved infection in the mouth. Then it's a discussion with the patient as to what the treatment options are. Sometimes it's a tooth that needs a root canal, sometimes it's a tooth that needs a root canal retreatment, and unfortunately sometimes it's a tooth that needs to be extracted. I do my absolute best as to counsel on the options available, and then certainly what option may be the best for each individual person. Lastly, anyone who is cavity prone, some people unfortunately get cavities very easily. That is also a bacterial condition, and with that is one that can be systemic, and certainly all of these bacterial conditions that we talk about can be transmissible. They can be shared. This is not an exclusive list in any way, but certainly is the majority of bacteria in the mouth that can affect the overall health. I hope you find this information helpful. I hope you know that I want nothing more than to help ensure your overall health. This is Scott Perocta again from Healthy Life Dentistry. Until we meet again.